In this video, we are going to show you how to use the Erler and Zimmer injection arm. Insert the measuring tubes into the holder and connect the vein tubes. Fill blood into one tube. Make sure both stopcocks are open. The level of blood in both tubes will settle automatically due to gravity. The arm is now ready for use. Perform the training to fit your requirements. We are going to show you some examples here. Do not forget to fill the blood taken from the arm back into the tubes. If you take a longer break from the training, please empty the vein tubes. To do so, press the piston into one syringe and push the blood into the other one and then close the stopcock. If you like, you may close the syringe with a supply plug. To empty the system completely, use the blood bottle and put the end of the vein tube into the bottle. Open the stopcock and press the blood into the bottle using the piston. If you need to replace the skin, simply cut it off and also remove the veins. After cleaning the arm, carefully cover the arm and the inner side of the skin with plenty of talcum or baby powder. Pull the skin over the arm and fold it backwards again. Cut holes for the vein tubes at the necessary places. Use the supply tool to pull the veins through the holes. Insert the puncture pads and place the tubes into the groove. Pull the skin forward until it is completely in place. Make sure to keep the veins in the grooves. Pull the hand skin over the hand. Do not forget the powder.